Hi everyone, my name is Robert Seifert and I will be your professor for Healthcare Economics. We are going to have a lot of fun this semester, I promise you. Healthcare Economics doesn't sound fun or interesting, but I'll let you know it really is, and you'll learn that as you proceed through taking the course online and interacting with each other and myself as well. I am officially new with the college and the Canvas environment. I'm accustomed to using Blackboard as a learning management system, so you will have to bear with me as I continue to learn the Canvas environment. That being said, the college has given me extensive training using the Canvas software, so I'm very comfortable with it. Again, I just ask that you bear with me as I continue to learn the intricacies of the software. I am originally from Reading, Pennsylvania. It is a small town or a small suburb outside of the city of Philadelphia, Pennsylvania. So I was born and raised in Reading. I have spent most of my adult life living and working in the city of Philadelphia. I currently work at Lee Health. I've lived in Florida, number one. Let me back up a little bit. I've lived in Florida for about 2 years now. This February 2018, it will be 2 years. And I love it. I've made a lot of great connections down here, and I've met a lot of great people. So, and I look forward to interacting with all of you in the online course environment. So I mentioned I worked at Lee Health. I do chronic lung disease management with the system, and I've worked within the healthcare industry for approximately 18 years, having many different positions and roles. So I really have a good grasp on how the healthcare industry functions on an economical level. So I've got a lot to offer in addition to my educational background. So again, we'll have a lot of fun. If you'd like to know more about my background and education, you can visit the information about my instructor section of the course, and you can read more information about me. Okay, enough about me, about you now. So what are my expectations from you as a student? I just ask that you please read the syllabus, the overview of the course, and the instructions within the course. And I ask that you please reach out to me with any questions or concerns you may have as we proceed throughout the course this semester. Again, I'm all about helping everyone. Also, please carefully read the instructions for each assignment. I've gone through all of the module posting questions. I've gone over all the assignments. I've looked at all the instructions, and they seem clear to me, but what seems clear to me may not seem clear to you or somebody else. So I need you to reach out and actively ask me questions, and I'll be there for you. It's no problem. I also ask that you're actively involved in the discussion area. I also want you to turn assignments in on time, and if you can't, due to extenuating circumstances, I need you to communicate with me and I will work with you. I am here to help all of you to succeed and help the learning process be a pleasant experience. We all have things that come up. We all have things that affect our lives. Everybody's busy today. So if you're going to be late with an assignment, just shoot me an email, let me know why. And if it's personal and you don't want to let me know why, but you need an extension, I just need you to communicate with me. That's all. Alright, so what can you expect from me? You can expect my daily presence within the discussions. I will be within the discussions. I will be responding to student postings and feedback on those postings. I may not respond to each and every one of you. Please don't take offense to that. My rationale behind that is I want to stimulate thinking and not necessarily for you to feel pressure that I'm going to respond to every one of your module postings. When I respond, it's going to stimulate thinking. So I will be there within the Canvas environment, within the course on a daily basis. I promise you that. Also, if you have an inquiry or question, I will respond to your emails immediately. If I cannot get to them immediately, I will get to them later in the day. My turnaround time for emails is fairly quick, depending on the question. Also, you can also expect me to have your assignments graded within a week's time of receiving them. The college's policy states that I can take up to 2 weeks to grade an assignment. It won't take me that long. I usually will get them back to you within a few days of turning them in. And if I have any issues or connectivity issues with the internet that would inhibit me from doing that, I'll communicate that with you. But I don't see a problem with me getting them back to you pretty quickly. All right, let's talk about healthcare economics. It is a branch of economics concerned related to the efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare. Healthcare economics aims to understand the behavior of individuals, healthcare providers, public and private organizations, and governments in the decision-making process. All right, so then how does the field of economics or healthcare economics apply to the healthcare industry? So how does the term economics apply to healthcare in general? Well, as consumers, each and every one of us have a personal stake in our individual health, and we act in such a manner that utilizes healthcare resources to maintain our physical and emotional well-being. This course is designed to help the student to better understand the economic side of healthcare. And what I love about this course, it's a great course for students who currently work in the healthcare industry and who want to broaden their knowledge on how health economics is used to promote healthy lifestyles, positive outcomes through a comprehensive study of healthcare providers, hospitals, clinics, managed care organizations, preferred provider networks, Medicare, Medicaid reimbursement, and public health promotion. Public health plays a significant role within the healthcare industry, and this course definitely covers public health and how it relates to healthcare economics. I love public health, by the way. It's my favorite. I have another master's degree in public health in addition to the one I have in health sciences, so I'm very passionate about public health. Also, on a final note, this course helps you to understand the economic dynamics of the healthcare industry, from how healthcare is produced, distributed, and consumed by people. That being said, I want to thank each and every one of you for taking this course. Let's have fun and learn together. I love to learn from students, and you'll learn from me. Let's have fun, and I wish all of you well as you take this course. Bye.